Good morning. This is Dr. De Silva. I am the Medical Director of Kids and Teens Medical Group, and we are offering telehealth for all of our patients to help them through the current COVID-19 pandemic. And today I want to talk to you about what's happening today, March 28th, 2020, here in California. So we continue to have a stay-at-home order, and I encourage you to continue to keep your children safe at home. Let them know that staying at home is the safest place. Safe at home. Stay at home, it's safe at home, and give them a lot of encouragement and support and lots of activities at home. And I want to encourage you to continue this bubble till we are told that it is safe. And we will know by what our health departments let us know in terms of hospital beds and cases of coronavirus in our community. And today what I'd like to do is review an article that is here from the Sacramento Bee, published today, March 28th, 2020. And the Sacramento Bee is obviously from Sacramento, and it's a trusted source for the state of California. And what they're saying today is that Italy shut down at 827 COVID-19 deaths. California did it at 19. Let's see the difference so far. When California Governor Gavin Newsom ordered all residents to stay at home and all non-essential businesses to close, the state became the first in the U.S. to impose a shutdown in response to the coronavirus pandemic. The move mirrored Italy's decision 8 days earlier to expand its shutdown to the entire nation, becoming the first European nation to do so. Despite sharing early leadership on shutdowns, California officials used Italy's overwhelmed healthcare system, where doctors have been forced to triage life-saving treatment, as justification for stay-at-home orders and social distancing. More than 800 people had died from COVID-19 when Italy's shutdown began. California's death toll had not yet hit 20 when Newsom issued his order. Italy and California's coronavirus deaths. The pace of deaths due to COVID-19 when California's shutdown order went into effect was slightly lower than Italy's, and the gap has widened since. The long-term impact of the Golden State's earlier shutdown will be seen in coming weeks. There's a really beautiful graphic that is in this article, and I will share in comments so that you can all take a look at this article. Italy and California differ in ways that could work in the Golden State's favor in the fight against COVID-19. California has roughly 2/3 the population of Italy, despite being geographically larger. Some health experts also point to Italy's older population and high rates of smoking as additional factors contributing to the severity of the coronavirus outbreak in that country. So this is really good information for us, and what we need to do is continue to follow stay-at-home order. And we can also I don't want to necessarily compare to the rest of the country, but if we do look at the rates in New York and California, California is far lower, and this is attributed to earlier stay-at-home orders and school closures. So it's really important as we continue in the next few weeks to continue to follow this strictly, as this is one of our most important defenses to reduce the rates of COVID-19 and associated deaths. It is true that a lot of cases will be milder. However, the problem is for those more severe cases and the need for hospital beds. And with yesterday's news of having additional 1,000 beds from the Navy ship Mercy, we are now in anticipation and preparation of additional beds. There will be more beds that are being prepared by our state and government. However, what we want to do is we want to help them. So they are helping our healthcare system, and we have to help them by continuing our stay-at-home order. I've seen in the news from New York, there are young adults, teenagers playing in parks and things like that, and currently we don't recommend that. Here at Kids and Teens, I'm recommending that all of our parents and our children stay at home in your bubble. We are going to help you in your bubble. You stay at home, you call us, or text us, or email us in any method that you need, and we will help you. And I'm committed to doing that. So if you have any questions, please do comment on our posts, and we will get back to you. Thank you so much, and remember, stay at home, stay safe, and we will be there with you through telehealth. Thank you.